because lips can swell and change the distance. The teeth is what we go by because that's not going to move. Okay, that's a more definitive, no matter how much facial swelling the patient gets, the teeth aren't going to change. Okay, so you do need to be familiar with your landmarks. So on your first of 5, remember last week I had you guys palpate your manubrium in lab? That nice little edge right about here, where it just kind of goes almost like an angle and then goes, right? There's 2 reasons for that. One, to help kind of get you guys comfortable with that, but right to the right-hand side of that is where you would listen for your aortic valve. Okay, so that's your A for aid to man. You go directly across to the other side, and that's your pulmonic valve. Okay, that is your second intercostal space on the left sternal border. You go down in between the next set of ribs, and that is going to be your Erb's point. All right, you go down one more time, then that is going to be your tricuspid valve. Now is when we get to move over a little bit. We're going to go down one more rib, but then we're going to move to the midclavicular point. Okay, most people are like, oh, it's right underneath the nipple. Yes and no, depending on the age of your patient. Because if it's an 85-year-old grandma, her nipple's probably down here. Okay? If it's a 6-year-old female patient, then yeah, her nipple's probably up here. But we go with the midclavicular line, so we have that grid there. We have our X and our Y axes, okay? So midclavicular line, 5th intercostal space, and that is where you're gonna find your mitral valve. That's also where we auscultate what pulse? Your apical pulse. Okay, and that is also your PMI. Okay. I don't want to turn my car on. Here it is. All right. Now you should be able to palpate the PMI over here. All right, but you should not be able to see it. I think I said that already. Okay. Oh, now for ladies. Okay. Some are more blessed than others, okay? And sometimes you might even run into gentlemen who have breast tissue or fatty tissue, they've got skin folds and stuff. So you might need to have them move that up and out of the way, okay? As long as they are able to follow commands, just have them move their breast tissue out of the way, okay? If not, this is where you gotta use the back of your hand to move it up. Don't cup it for them, because then if somebody walks by, then that puts you in a very odd predicament, okay? Because, oh my God, he's groping the patient. It happens. So I definitely want to make stress to you guys to use the back of your hand, because can that be misconstrued? Oh yeah, I'm really trying to fill her up. Okay? And if you've ever been, patted down by the TSA, they're not as understanding as healthcare workers, okay? Now, earlier we talked about love and dove, right? S1, S2. Where do we hear S2 best? Aortic, up here. Okay? We're going to hear S1 best over here. You would think that it would be 1 and 2. No, it's opposite. Okay? Talked about that. Unexpected findings, tachycardia, bradycardia, dysrhythmia we talked about. Don't need to worry about the extra heart sounds as much, other than the fact that you know that those are not expected, okay? Also too, when it comes to pericardial friction rub, and we didn't get to talk about this yesterday in the lab, but it's very similar to what the way it works is very similar to how a pleural friction rub works. Do you guys remember how that works? It's inflammation of the lining and the outer portion of the lung, right? There's inflammation there, it gets really irritated, and it causes it to sound really rubby. The same thing can happen within the heart, okay? Because we have this nice little pericardial sac around the heart, And on the inside of the sac, on the outside of the heart, is lubrication. Again, because it's doing this all the time. Okay, the heart's the one organ that does not take a break, and if it does, that's a problem. Okay, so that area there can get irritated as well, and you can hear a rubbing sound with the beat of the heart. Okay, and that would be a pericardial friction rub. Okay, now we're not going to be doing this. What we're going to do instead, because you guys have been so good, a little patronizing, I apologize. I'm going to give you guys a 10-minute break. Okay?
I'll just like that.